It's very hard to lift the lower lid higher because gravity is acting against you, and oftentimes there are specific anatomical features present that predispose to the problem. They may have been missed on initial examination, but they still exist. In more recent times, we have found that fillers, particularly the gel fillers such as Restylane, Belotero, Perlane, can be used to address these issues. I primarily use Restylane because its biochemical makeup is most appropriate for this, but I can do things with fillers and lower lids that are pulled down that I cannot do surgically. It's not a permanent fix, but oftentimes, after a second or third injection, the tissue's been stretched enough that surgery is easier to perform. So fillers are very, very unique. This is how I want you to think about fillers. Think of a sponge that's dry and think of a sponge that's wet. When the sponge becomes wet, it expands in 3 dimensions. By doing that, it will fill hollows, efface or get rid of depressions, and most importantly, it will lift because it expands 3-dimensionally. Because it lifts and fills, we can address so many problems that traditional surgical techniques don't address. Here's the problem with fillers. There are so many on the market, and it's so ever-changing, the field, that a lot of practitioners use a filler, and then a new one comes out and use a new filler, and then a new one and use a new filler. The issue is just not using any filler. These are injected indiscriminately everywhere for lines and folds, but they all have a particular biochemical makeup and a particular purpose. And if you're going to inject fillers, you better understand the product so that you can manage the complications and inject it correctly. And unfortunately today, with doctors being so busy, with so many things going on, with surgery, with patient care, etc., it's very difficult to stay on top of this. But there are those that do, and they do very unique things with fillers. And I have colleagues all over the country who do this, and we work together to constantly evolve and transform this field so we can get better outcomes for patients.